All right, it is 2:02. I want to get started. I want to welcome everybody to our webinar today, which is scheduling best practices. I want to let you know that we record all of our live webinars and store them on demand for folks to view later if they could not make the live recording. All the resources we share throughout today's webinar, including the PowerPoint slides, will be made available with the recorded version on the on-demand webinar page of the New York State Resource Hub in a few days. You must be registered to attend today's webinar. If you're not registered through the Resource Hub, you will not be able to access the evaluation certificate. Per New York State DOH policy, if anybody who misses more than 15 minutes of today's webinar will be removed and asked to review the recording at another time. The webinar door or Zoom door will be closed 15 minutes after start of today's webinar, and no one will be permitted to enter after that time. For those that don't know me, I'm Deb Bonzo. I'm a registered dietitian. I've been with CEI for over 2.5 years as a senior trainer, but I'm not new to WIC. I spent 34 years in upstate New York as a WIC nutritionist, outreach coordinator, site supervisor, WIC coordinator. And that's where I got a lot of this hands-on scheduling practices. So I'm really excited to be here with you today. This is one of my favorite topics to talk about and help agencies with. I also want to introduce Kat Smith. She's our producer today. So if you're having any technical difficulties, please reach out to her. She's here to help and assist you. I want to give a little bit of an introduction to CEI. CEI is a nonprofit organization with over 40 years of experience working at local, state, national, and international level to help organizations improve healthcare, social services for historically marginalized communities. We do this by providing high quality education, training, research and technical assistance to services to organizations servicing diverse communities. Some of our projects include sexual and reproductive health, maternal and child health, sexual violence prevention, HIV, STD, substance use, mental health, and tobacco use, to just give you some examples of the scope and range of our work. And of course, we currently are contracted with the New York State WIC Training Center. CEI's mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, and equitable world. At CEI, we believe WIC has the power to change lives. This training was developed through a collaborative relationship with the New York State Department of Health WIC program and Chickatelli Associates. Funding for this training was provided by the New York State Department of Health or Department of Agriculture. Here's the contact information both for New York State DOH and CEI. Same slide. This slide indicates the policy information we will be discussing today are derived from the United States Department of Agriculture and the New York State laws and regulations. Everything we discuss today comes from policy documents that are available in NIWIC. I have nothing to disclose. Today's training goal is to enhance WIC staff's understanding and implementation of effective scheduling practice to boost staff efficiency and optimize participants' access to services. Our learning objectives: to recognize that scheduling is both an art and a science, identify scheduling best practices, analyze data collected from prior learning communities on scheduling, list strategies to ensure compliance with WIC policies and enhance overall scheduling efficiency, and describe tools and techniques for monitoring and adjusting schedule to meet demand and capacity effectively. Let's get started with a poll question. I want to hear from you. How did you learn the scheduling process in NIWIC? And there's a couple choices. I taught myself through trial and error. I inherited a schedule, online resources, mentoring and advice from others. I'm still trying to figure it out, or we have an other option. Yeah, Jenny, definitely. She wrote it's kind of a combination trial and error. We've got a mixture here, really. So about 16% of you said kind of self-taught, trial and error. 14% said an inherited a scheduling system, which we hear all the time. 9% said online resources. 42% said mentoring and advice from others. 11% said still trying to figure it out. And then 8% said others. We know scheduling is complicated, right? So thank you so much for sharing. Let's look at scheduling. Scheduling is both an art and a science. So the art of scheduling is about understanding the human needs. It's the personalization. It's tailored to meet individual participants' needs. It's adapted to the schedule for both participants and staff's needs. Alternative hours, early morning, evenings, and weekends for working families, providing a walk-in line or maybe same-day slots for urgent cases, scheduling with the same nutritionist, which we just did a webinar on that on Tuesday, and it will be on demand in a couple of days if you're interested in reviewing that. Seasonal adjustment, modifying the scheduling around school breaks, peak demand periods, summer months when children are out of school. Also under this art is cultural sensitivity. We want to align appointments, slots with cultural practices, holidays, participant preference, scheduling bilingual staff when needed. So if you have bilingual staff, paying attention to how you schedule them and where you schedule them. It includes effective communication. Staff can identify gaps in the schedule. They need to communicate with the coordinator, whoever's in charge of the schedule when they find those gaps. Communication with community stakeholders to recognize needs and changes to the community. Staff input on scheduling preference can improve morale and service quality. Clear instructions on what to expect during the appointment. This would include a length of time, documents needed, and appointment modality. The reminder system should be friendly and human-centered. And then still under the art of scheduling is continuous improvement. Monitor your schedule on a regular basis and make changes as needed. This could be changes to staff or caseload. Response to feedback from participants and staff will enable a WIC agency to adapt its scheduling system. Check and adjust your scheduling methods regularly during a trial period. This approach can help you use your time and resources better and make your participants happier. Then the science of scheduling are those requirements. It's the caseload. It's the number of participants currently receiving benefits. It's scheduling policies like the 10, 20-day requirement and alternative hours. It's a scheduling guidance document, and we will discuss this more later on in the webinar. It's resources, and staff are a resource. Aligning staff based on availability and skills. Capacity, the ability to see participants. This is based on the hours of operation and nutritionist availability. Time study, collect data, determine how long participants are spending with a nutritionist and support staff for each visit type. And we're going to review previously collected data from the learning community. The demand in your schedule is your caseload. It's the number of participants you are servicing. You need to understand the number of participants you are currently servicing, and some things we want you to understand are appointment types. Do you have a lot of initial certification appointments? Policy changes. Be aware of changes such as the American Rescue Plan waiver, which allows for virtual appointments. Data collection, data collected during the 23-24 learning community showed that 92% of appointments were being held virtually. Interpretation needs. You want to identify if you have a large number of participants in your community requiring language services. You want to identify high demand times and days. Identify days and times where the demand for your service are the highest. And then recognize seasonal changes. Changes in your caseload during the summer months when farmer market coupons are distributed. Or do you see changes in your enrollment during months like November and December? Know your community needs. Evaluate the needs in your community. Have they shifted? Has there been a change, right? And then alternative hours, to consider whether you are servicing many working families. You may require appointments outside normal operation. So those are things that we have to continue to look at. That's the demand on your schedule. Capacity is your staff, and we're going to talk about staff as a resource. It refers to the staff's availability to provide service to participants. Staff should be managed and valued similar to other resources like equipment and finances to ensure efficient operation and productivity. When planning for hours that are available to see participants, what do you consider? These are questions. Do they have other duties? Like, are they your breastfeeding coordinator, your nutrition coordinator, your outreach coordinator, your training coordinator? What are the hours that your site are open? What's the first appointment of the day? What's the last appointment of the day? And what are the total hours that your staff work? Are your staff scheduled to work 32 hours a week, 35, 40? It varies from agency to agency. Let's review some of the data that's been collected from prior learning communities on scheduling. And I'm going to start with another poll question. What data do you use to evaluate your scheduling needs? And you're able to choose more than one response here. And that could be things like the participants scheduled outside the 10-20-day limit report. If you've done a capacity and demand tool, desk audit, time study, caseload utilization report, no show rate by hour report, or others. So about 51% of you said you look at the participants scheduled outside the 10-20-day limit report. Fantastic. Another 38% of you said you've looked at your capacity and demand tool. Desk audit, 15%. Time study, 13%. Caseload utilization report, 38%. And then show rate, 25%, and then others is another 25%. And I'm sure many of you look at multiple things when you are evaluating your caseload. Let's continue. I know you've heard this over and over again, but the 2023 to 2024 learning community conducted a desk audit, and during which 92% of appointments were held remotely. And what I'm hearing is that's probably true for most of you today. Majority of your appointments are still being held remotely, and that's important to know. Then the 22 to 23 learning community conducted a desk audit. collected data on how long the clerk or support staff spent with each visit type. This chart shows the average time the clerk spent with participant by visit type. It ranged from an average of 14 minutes at the longest for certification and 3 minutes on average for nutrition, education, health and nutrition updates, and visits that were categorized as others. I really also want to highlight here that many agencies are no longer using the clerk or support staff for health and nutrition updates or nutrition education appointments or food package changes, thus freeing up the support staff or your clerks to take on other tasks and duties. Then the 22 to 23 learning community collected data on how long it took the nutritionist for appointments based on appointment type and number of participants in the appointments. And so let's just review this together. So certification, it took 22 minutes on average. Recertification, 16 minutes. Health and nutrition updates and nutrition education appointments, 9 minutes. Food package changes were 9 minutes. And visits classified as multiple visit types, 19. Then they looked at the time based on the number of participants in an appointment, because we know that affects how long the appointment's going to take. So when there was 1 participant, it took on the average 11 minutes, 2, 15, 3, 19, and 4, 20. The 2019 learning community found that using interpretation services added an extra 12 minutes on average to the appointment. This is important information and useful information for you to have when developing your agency's scheduling guidelines. If a participant needs to have interpretation services, you should be adding extra time to that appointment. The nutritionist portion of the appointment is longer than support staff, so the schedule should be built based on how long the nutritionist needs with participants. Each agency needs to make the best decision regarding the amount of time assigned for each appointment type based on the data we just provided, insights from your capacity and demand tool. So we want you to look at multiple data and make the best decisions for your agency. This approach will help agency allocate the appropriate amount of time for each appointment type within the WIC schedule. So I didn't make this a poll question, but I'd love for you to put in chat. I'm really curious, how long does your agency give for 1 initial certification? So if it's a 1 initial certification, how long does your agency give? Great, thank you for getting us started, Chloe. I've got 60 minutes. Yeah, this is exactly what I was knowing you guys would respond. So it ranges by agency from 30 to an hour. Okay, we've even got some 15 minutes with the nutritionist. Great. There's no right or wrong answer, but we do want that number to be based on data that you have for your agency. So thank you so much. So let's look at some policies. WIC policies help guide and enforce your scheduling practices. On this slide is the table from WIC policy 1460, local agency nutrition staff policy supplement. This shows the minimum allocated hours for the nutrition coordinator and breastfeeding coordinator roles based on your target caseload. So based on your target caseload, That is the minimum hours that should be provided for those two roles. And I recommend that you plan for that in your schedule. All right, staff to participant ratio. One nutritionist to 700 participants is used as a guide per WIC policy 1460 policy supplement. Based on my experience working within the local agency and coaching many other agencies, it appears that one nutritionist can efficiently manage up to a maximum of about 1,000 participants, or seen up to 4 participants an hour. After having to see 4 participants an hour, it becomes very difficult to manage. Other policies that we have out there that help guide us are our 10-20 day processing time frame, 10 calendar days for individual with special nutritional risks. These include pregnant women, infants up to 6 months, migrant farm workers, emergency referrals, homeless, and 20 calendar days for all other individuals. Participants scheduled outside the 10-20 day limit report should be reviewed on a regular basis. And love for you to put in chat, how often do you review this report? Are you reviewing it monthly? Anybody reviewing it weekly? Okay, we've got weekly, got monthly, every 2 weeks. All right. And again, your goal is to keep this report as small as possible. Great. A lot of people are reviewing it every 2 weeks. I think that's great. It gives you a great pulse on what's happening in your agency with your scheduling. Also, other appointments availability. Local agencies must provide alternative hours for WIC appointments to accommodate the scheduling needs of your participants. You need to provide appointments during lunchtime hours. Those hours do not count towards your alternative hours. And just kind of an FYI, the Department of Health is updating the definition of alternative hours, making minor adjustments to the minimum hours required table. WIC policy 1216, high risk care. High risk participants must be scheduled with a QN for recertification appointments. So you have to figure out how to make that happen. All right, in this section, we'll review together some best practices for scheduling. Do not limit access. You must offer in-person and virtual appointments for all type of appointments at every site during hours of operation. Examples of limiting access would be you only do P-certs on Friday, or only offering in-person appointments on Monday afternoon. We don't want to limit services like that. We want to offer real choice. What we see as an advantage of one appointment modality may not be an advantage for our participants. Participants are the experts of their own lives, and we don't need to make judgment about what's best for them, including labeling differences in appointment modalities as advantages or disadvantages. Staff must offer appointment modalities without bias. Scripts are for offering real choice can be found in the WIC library under nutrition services, participant-centered services, and then sample scripts. So we've created some sample scripts from prior learning community that you can download and use as your own. We encourage you to reduce your scheduling complexity. All staff should schedule the same, meaning all staff give the same appointment type, the same amount of time. And the schedule should be monitored regularly to make sure this is being followed. For example, you shouldn't have one nutritionist scheduling an H&U for one participant for 15 minutes, while another nutritionist schedules them for 45. You want to have consistency throughout your agency. You want to provide staff with scheduling guidance that's simple, easy to follow, and easy to carry out. You want to minimize scheduling restrictions. All appointment types must be available at every site every day of operations. So factors that agencies may want to consider when determining appointment lengths could be things like appointment type, the number of participants within that appointment, the need for translation or language services, high risk status, breastfeeding, the need for anthropometry or hematology to be done at site, and any other considerations local agencies find relevant for their agencies. I do know with working with some agencies, they add a little extra time if it's a brand new participant because it's going to take longer to explain the program. You want to have standardization for appointments type, standardize appointments types and lengths, develop a few criteria to help categorize the appointment as short or long. You want to explore the average participant time per visit by conducting your own time study or using the data collected from the 22 to 23 learning community. I want to remind you that your participants are used to seeing standardized appointment types, as are you. You're going to find standardized appointment types at your dentist, your healthcare provider, your hairdresser, your plumber, your mechanics are all going to schedule you based on that appointment type. You need to build your scheduling template based on time. The first and last appointment of the day, staff starts at 8 a.m., but the first appointment isn't to 9:15. Maybe that's not working for your agency. Or your last appointment of the day is 3 p.m., but your agency doesn't close to 5. You want to make sure breaks and lunch are included. You want to make sure that you have hours allocated for your breastfeeding coordinator, your nutrition coordinator, and your outreach coordinator to carry out their assigned duties. Do you have time in your schedule for staff meeting, continuing education and training? And your site hours should match the needs of your participants. You want to build that template based on the number of appointments needed per day. This should be based on your caseload and nutritionist availability using data. All of your templates must have a resource line labeled walk-ins. The capacity and demand tool developed by CAI will tell you how many participants each nutritionist needs to see per hour to meet caseload. And I want to let you know that the capacity and demand tool is available to any agency through coaching. You would just need to fill out a coaching request and submit it to your regional office for approval. And I also want to note that on these slides are just some examples of templates. They may look a little different for your agency. Some agencies do not schedule breaks, but use no-show appointment times as breaks. Each agency must have a process to monitor and follow up on online nutrition education. The best practice is to monitor the dashboard and run that report daily, but at the minimum, that information must be reviewed once a week. And then you need to identify a staff responsible for reviewing the completed online nutrition education and the follow-up. What's your plan? What's your systems that your agency is using to follow this? You want to block off a realistic amount of time in the WIC schedule if your nutritionists are conducting and monitoring the follow-up. So maybe you have a nutritionist at your agency that's responsible for that. How much time do you need to give them per week to do that? Other staffing requirements that you may need to consider when creating and applying the scheduling templates in WIC. You want to consider your staffing requirements for your temp site. Our staff pulled out of the perm site to cover the temp sites. Are you doing pop-up clinics? Is there an outreach event? All these temporary assignments may impact the availability of staff to cover your permanent sites. We want you to plan for that. The following strategy could be utilized when implementing the schedule in WIC to help meet the 10-20-day requirement. I've talked about this a couple of times in other webinars, but we recommend that you create 2 templates that can be laid on top of each other. First, template A should provide enough appointment slots to accommodate 75% of the need of your agency. Template B should offer the remaining 25% of the appointments. What you would do is apply template A to a date and range and site 3 months in advance. And then you will apply template B to a date and range, or to a date and range and site 1 month in advance, or 1 week in advance. By opening the last 25% 1 week prior, will ensure that you have enough appointments to meet your 10-20-day requirements. This works. I've worked with many agencies that have tried this, and it really works, and it really diminishes the participants that would appear on your 10-20-day report. Requires a little bit of work up front. You have to create 2 different templates, and you have to pay attention and monitor. How do you schedule within the template appointment time slots? You need to develop an agency scheduling guidance document so all staff understand how much time to allocate for each appointment. Appointments should be 15 or 30 minutes in length. And we are talking about the time spent with the nutritionist. I want you to know that New York State DOH has put in an enhancement request to change the appointment time increments in WIC to default to 5 minutes. Things to consider when creating the scheduling guidance document is, just as a reminder, we talked about certification being 22 minutes on an average with the nutritionist. Recertifications were 16 minutes. Health and nutrition updates and nutrition ads, 9 minutes. And food package changes were 9 minutes. We also gave you some guidance on how long the appointments took when there's additional participants in that appointment. And remember, we said that it took on an average 12 extra minutes if you had to use language resources for that appointment. All things that should be considered when creating the scheduling appointments. Staff must consider the following when creating the local agency guidance to ensure it meets your target caseload and community needs. You want to consider your staff schedules. What's your ratio of support staff to a nutritionist? We want to make sure there's a smooth transition between your WIC staff during virtual and in-person appointments. So we don't want any delay, whether it's in-person or virtual. You want to make sure your physical environment has the capacity to handle an appointment flow without bottlenecks or disruptions. And you want to consider appointment times and duration. You want to schedule appointments with adequate time to provide participant-centered services and complete required documentation, and allow for same-day appointments if feasible for your agency. We're recommending that you schedule by lines or columns versus appointment types. And appointment types would be one line for certs, or one line for in-person appointments, or one line for remote appointments. As you saw on the previous slide, one method to identify whether an appointment was in person was to assign them to a designated in-person line. But what we know is that since many or most participants are requesting remote appointments, this line often has many empty slots. Therefore, we believe that using appointment notes may be a better option for identifying if that participant is in person versus remote. Adding an appointment note will underline the participant's name as shown on the right on the slide. If an agency chooses to add a note for in-person appointments only, those appointments will be the only one on the daily schedule underlined. Staff can see at a glance that the underlined appointments are in person, while appointments without the underline would be remote. Appointment notes will also show up on the site appointment list report, and directions for adding a note to an appointment can be found in the NIWIC guidance packet in the WIC library. Create scheduling guidelines for your agency based on data. You need to determine how many participants need to be scheduled per nutritionist per hour. You need to determine how many participants need to be seen per hour per nutritionist to meet caseload. And again, if you're interested in doing a capacity and demand tool for your agency, just fill out that coaching request. All right, I have another poll question. How often do you monitor your schedule? Is it daily, weekly, monthly, quarterly, yearly, rarely? Looks like 83% of you are daily. Love that. You need to have your pulse on that schedule. It can change very rapidly. You need to create a system to monitor and analyze the schedule. While all staff should monitor the schedule regularly, there should be a go-to scheduling person. This could be the WIC coordinator, or it could be someone else for your agency. We want to ensure that all staff are scheduling the same and following your agency's scheduling guidelines. Are there appointments available for your priority appointments, the 10, 20-day requirements? You want to know that at all times. Modifications. Schedules may need to be modified when there are changes to your staff schedule, or when staff leaves, or when new staff are hired. Changes to your participants' needs, changes to your caseload. Maybe your caseload's gone up. Maybe your caseload's gone down. Maybe there's been change to your community. You could use NIWIC reports to monitor the schedule. This slide shows some of the NIWIC reports that you could use to monitor your schedule. I just pulled out a few. We've got the caseload utilization report. We got participants scheduled outside the 10-20 day limit, the list of missed appointments, show rate. WIC staff can refer to the NIWIC reports, quick guide for local agencies that's in the WIC library. It's a great tool. It tells you how to access the reports and what they should be used for. We want to really highlight that schedule is something that you don't create once and forget about. They require ongoing updates and adjustments to stay effective. You wanted to monitor the schedule regularly. Most of you are saying you're doing that daily, which is great. You want to know how to communicate modifications to the schedule. You want to know how to communicate them with your community, with your staff, with your participants. You have to figure out a system how to do that. Again, I want to highlight some tools that are available to help you create and implement a schedule to meet the needs both of your participants and your staff. So CAI can assist you in completing or conducting the capacity and demand tool. You could conduct your own desk audit. You could conduct your own time study. You could do an appointment flow analysis. You could ask for individual coaching from CAI. We also encourage you to collaborate with your colleagues. Your colleagues out there figured it out, collaborate with them. You can also ask your regional office for assistance. I want to share an example of a scheduling guidelines. Kat's also going to drop it into chat. This particular scheduling guidelines would allow for 3 to 4 participants to be seen per hour per nutritionist. All right. Some agencies, the nutritionists have to see 2 participants per hour, and their scheduling guidelines that they would give their staff would look a little bit different. I'm going to, we have some time for appointments, but I know there were some appointments in the chat. So I'm going to try to go back and look and see if I can answer some of those. So Kelsey, I think you asked, why would we want to change NIWIC for 5 minutes? I think it has to do with some of the timing. So if an initial certification takes 14 minutes with your support staff on average, right? These are averages, and 22 minutes with your nutritionist on the average, you have an appointment now that should be scheduled for like 35, 36 minutes. NIWIC doesn't allow that, right? So agencies would have to determine if they're going to round down and make initial certification appointments for their agencies for 30 minutes. Or some agencies have the ability to round up and would be able to make an initial certification appointment for their agency for 45 minutes. Their overall time of the schedule would not change. There wouldn't be any more hours added to the day. It would just be, you would just have some flexibility of how you schedule within the NIWIC template. Okay, hopefully that answered that question for you. What other questions do people have? I
Hello.
Yes, go ahead. Yes.
Hi. I have a question. I mean, we struggle somewhat with most of our participants are choosing doing remote, but we also have a lot of walk-ins. So with time, if we give a participant a remote appointment at 10 o'clock, but we have five walk-ins, it's hard to juggle. So who do we take first? The one that has an appointment or the one that's in front of us? And sometimes even the one that has an appointment, they have a 10 o'clock, but you have to call them like 20 times because it's on their time.
Yes.
So
Yes.
that's something that I really thought that we're the only agency struggling with, but what would you suggest or recommend?
Yeah, Minerva, I would suggest that you stick with the person that has the appointment time. Okay. And just like we handled walk-ins before COVID, right? We weren't always able to take care of a walk-in that day, but we were often able to schedule them another appointment or give them options and say, we have maybe they walked in at, I'm just going to make this up, at 10, but you can say, we're going to be able to see you at 11:30. Would that work for you? We have an opening today. All right. We know walk-ins have always been difficult, but you don't want to handle them any different than you did prior to COVID. Okay. And I know it's more complicated than that. And I know it's really hard when people are standing in front of you and they see an empty lobby, but you can just explain what, we have appointments already, and try to do your very best to get them in as soon as possible and give them options.
So what about also, so we have the data analyst in the front. She is a recertification. She does her part, but now she says, okay, the nutritionist will be calling you back because she can't just transfer because the nutritionist is finishing up with the other participants. So when the nutritionist finally calls them back, they're not picking up the phones. And then
Yeah.
they have to move on to the next participant. So it's always like a back and forth, some delay.
Yeah, no, I totally get it. And I know many of your colleagues on today's webinar have also struggled with that. One of the things I'm going to encourage you to do within your agency is make sure that that support staff or nutritionist are working as close together as possible so that there is minimal delay between the support staff and the nutritionist being able to call them. That's ideal. Where we know we run into a little bit more difficulty is when there is, the 15-minute, 20 minutes from one to the other. And I know it's difficult. Okay. All right. I've got a few more questions coming into chat. Joanna says, how do you use the time study data? I recommend using the time study day data as a means to put lengths of time for your appointment types. So taking that time study data from the learning community and knowing that initial certification for one participant would take 36 minutes. And how do you then apply it to your agency? Agencies are going to have to decide if they're going to change that appointment into a 45-minute appointment or a 30-minute appointment. I will tell you, I know some of the colleagues on this call could not do 45 minutes for certifications. They do not have the capacity. They have too many participants, so they have to make it 30 minutes. I know other colleagues on this call can do 45. Okay, so it's just going to depend on your capacity. So you take the time study data and you kind of layered it over with your capacity. I want to go back to this document that I have up here. Was created using the data from the time study. Okay. Yeah, I love Mickey's idea Mickey said you may be able to see the walk-in if you have staff covering elsewhere that could take that as a virtual call. Absolutely. Some agencies are getting really creative that walk-in. They can help that create that walk-in into more of a virtual appointment and have staff at another site take care of that person. Yeah, Jeannie's saying the scheduling appointment is always the priority. Yep. Yeah, and Michelle's saying when that virtual appointment does that not answer, they give them 15 minutes. And after that, I believe they would consider them a no-show. So that helps Minerva too. Yeah, Heather, that time slot includes both the clerk and then the QN, the 36 minutes. Yes. What other kind of questions? I really suggest if you're interested in kind of exploring how to tweak your current schedule, that you start with the capacity and demand tool. That is going to tell you, based on your current hours of operation and your current staffing, what is the number of participants each of your nutritionists needs to schedule and see per hour that they're available to meet caseload. Jeannie, if you're interested in doing the capacity and demand tool, it's done through CAI. You have to fill out a coaching request and put on the coaching request that you're interested in doing a capacity and demand tool. And then you would send it to your regional office for approval. And then it would come to CAI and we would work with you about getting that set up. Anybody that's on this webinar that's done the capacity and demand tool, want to just maybe give a quick highlight of the tool, something that it did for you? Melissa said she highly recommended. Michelle, go ahead.
Of course I'll go. So yeah, we did it in the learning community this past year, and the tool was eye-opening because it did allow us to see that our nutritionists were actually, some of the nutritionists were actually above what they needed to see, and some of them were just a smidge below, but it kind of made me feel good that the current recommendation, our current scheduling guidelines were on point. So I could see where if we were lower, where we would need to change our scheduling guidelines. So that was really good. And I highly recommend it.
Yeah, it's great. And once we do the tool for you, if there's any changing to your staff or your caseload, we can update them for you within minutes. So it's very useful. Great. Well, thank you, everybody. We are at time. I could talk about this topic all day long. I love this. So if you're a registered dietitian or a registered dietech seeking continuing education credits through the Commission of Dietetics registration, you are encouraged to complete an additional or optional evaluation. Thank you so much for joining us today. If you have questions about scheduling, we're here to answer them. You need to go to the resource hub and find today's training and fill out the evaluation in order to receive your certificate. Thank you, Kat, for putting that in. Jeannie, are you able to come off, unmute yourself and tell me a little bit more about your question?
Can you hear me? Hello?
Yes, go ahead. Yes.
Oh, so I was wondering because we always get the recommendation like how many QM per how many participants they're supposed to see. So you said that the current recommendation is 700 participants per one QM. So how is that broken up daily? Like are they supposed to see about 20 to 28 participants per day to get this 700?
Yeah, I think it's not even that high with the 700. So real quick, just some rough math. What I would do is take that, I would take your number of, let's pretend it is at 700 for each of your QNs. I would take that 700 and I divide that by 3. So that's 233 per month that each QN is responsible. Then I would do one more thing. I divide that by 20 days because most agencies are open 20 days a month, most. All right. And so that is 12. It rounds up to 12 participants, Jeannie, a day that they would be responsible for.
12 participants a day. Okay. Yeah. We see about 30 a day each. Okay. So that's how they came up with the 700 number?
That's roughly how you apply the 700 number. Okay. But if you're interested in knowing how many participants your nutritionists are responsible, we could do the capacity and demand tool. Okay. Or you can take your current caseload and divide by the number of QNs you have. That's going to be roughly your number. Okay.
I see. Got it.
It does not take into account if someone also is your breastfeeding coordinator and your nutrition coordinator and needs time for that, the capacity to demand tool is more sensitive and breaks it down. Okay.
Okay. Understood. Thank you.
Yeah, no, would love to do that with you. Would love for you to explore that.